So this is a presentation about new serum protein biomarkers to detect for MS. So MS is called multiple sclerosis, and it is a chronic autoimmune condition whereby myelin sheaths surrounding nerve fibers are degenerated. And it distinguishes itself from other neurodegenerative diseases because it affects mainly young people. And it has a large variety of symptoms, which are as follows. But the main ones to keep note of, in general, are impaired motor function and sensory function. So the various factors which can cause MS is no one cause. For example, previous infection with Epstein-Barr virus has caused it, genetic mutations, being of the female sex, smoking, and having low sun exposure have all been related to MS. And this ties in with diagnosis trends, whereby prevalence is increasing worldwide, but actually it mainly occurs in the northern and southern hemispheres, whereby UV exposure is quite low. And this slide shows that there are multiple types of MS, so it's quite a complex disease. And I think to keep in mind are these spikes. So these spikes represent attacks, or what we call relapses in MS. And these are just when symptoms arise up. So MS is quite hard to diagnose at the moment, partly because there's so many different types, but because there's no one single accurate and standard test for MS. And MS, because of this, MS has had quite a high misdiagnosis rate of up to 18% for initial diagnosis. Now, with diagnostic tools which exist, there are a variety of tools, such as observing clinical symptoms, laboratory chemical tests, such as measuring cerebral spinal fluid protein levels, and also imaging tests, such as MRI, detecting for lesions. And all of these tools would then be used in combination with what's called the McDonald criteria. And this is just a score which helps diagnose and classify MS. And an important factor of this is the presence of what we call gadolinium enhanced lesions, an imaging biomarker which is specific to MS. Now, currently the diagnostic workflow involves observing a patient's clinical symptoms, then undergoing further tests such as MRIs and chemical tests, and then putting all of these through the McDonald criteria, which can then be used for diagnosing MS. Now, for knowledge gaps in this field, machine learning is currently being studied, but it's not quite there yet for diagnosing MS. And fluid biomarkers which exist are quite limited, so mainly it's CSF spinal tapping, but new serum protein biomarkers from blood, such as neurofilament light chain, are being investigated, such as in this study, and we'll talk about that more. So neurofilaments are the major structural proteins of neurons, and they consist of 4 subunits, including light. So neurofilament light chain is one of these subunits, and it's very promising because it's released in blood following neuronal damage. So now for an aim. So to summarize fitness, her goal was to try to search for new serum protein biomarkers to measure MS disease activity. And this has the potential to complement or even provide alternative measures of MS. So to introduce methods, 630 human serum samples from deeply phenotyped cohorts were used to measure protein concentrations. When I say deeply phenotyped, I mean clinical granular observations described using type language. So these phenotypes inform the study's endpoints or measures of MS, which are as follows: the presence or count of gadolinium enhanced lesions, GD+, the patient's annualized relapse rate, so whether they suffer 0 or more than 1 attack per year, and the patient's clinical relapse status, so whether the patient was suffering an attack at the time they're having the blood drawn. So the methods can actually be summarized in 2 parts. The first is protein selection. So how did Chitness select 20 proteins from our panel of 1400 and protein analysis? So how did Chitness relate 20 of these proteins to the MS disease endpoints? Which were the most important? Now first is protein selection comes measuring, and this was done using commercial immunoassays, and values expressed here were dimensionless NPX values on a log-2 scale. After this, the 20 proteins needed to be selected from 1400, where Chitness used machine learning models depicted here. of which there are two types of models: a univariate model, which tries to predict one protein for one endpoint, and a multivariate model, which tries to predict several proteins for one disease endpoint in MS. And the proteins would be scored according to their relevance to disease endpoints, which would then be combined, reweighted according to external factors, and the top 20 proteins would be selected from this panel, which can then be carried forward for later investigation, such as the construction of a custom assay panel. So the 20 proteins selected turned into a custom assay panel, after which 630 of the original samples are remeasured. After remeasuring these samples, the measurements are normalized according to account for variation in technical and biological factors, and this just makes for fair comparison. So now we're ready for analysis. We have our concentrations. So Chipness used univariate techniques, which involve box and distance plots and significance, but we'll be focusing more on her multivariate machine learning technique, which is more complex but useful. So for each endpoint, machine learning models and bootstrapping was used, whereby data was randomly split and resampled 1,000 times for each endpoint. An example seen here. So for each split of data, 2/3 of the data would be used for training a machine learning model, and 1/3 would be used for experimenting, testing said model. The purposes of this are to prevent overfitting of curves and to reduce the impact of outliers. So for each bootstrap split, each of the 1,000 were used to train models to predict for whether GD plus lesions were present, how many there were, whether a patient is currently having a relapse, and if the patient had suffered a relapse in the past year. So all of these splits would then be averaged to form a final model, which would give our results such as follows. But first, let's discuss univariate results. So for NFL was the only protein which displayed strong and consistent trends relating to worsening disease endpoints. So as protein concentration increased for NFL, so did the lesion count in patients, so did the attack status, and so did their annualized attack rate. Now for multivariate analysis. The following shows a model trying to predict for the count of GD plus lesions, and it had an awful fit. But what it did tell us was that NFL was the most important predictor in measuring disease activity. Yeah. The following shows an ROC, procedure operator characteristic curve, and it shows how well different protein combinations can predict for GD plus lesion presence. This is the plot of each of the 1,000 bootstrap simulations, true positive and false positive rates. The way to measure this is through OROC. So OROC is the area underneath the curve, and an OROC of 1 would be perfect predictive performance. So looking at this, here we see that if NFL is used by itself, it has a strong OROC of 0.79. But if we add 4 more proteins to this mix, performance is increased very slightly. But what's really important is when we remove NFL, the performance of the model decreases quite significantly. So it highlights NFL's relation to this disease endpoint. Similar story is told for CRS and ARR, whereby NFL was the most impactful protein for measuring disease endpoints. But for these models, other proteins were also important, such as serpina-9 and CRS. Now overall, to summarize, NFL was the most prominent protein relating to worsening disease endpoints. And this is best shown in the multivariate models, where performance drops significantly without it. But the study also shows that signaling from other protein molecules are also just as important to measure this activity. Now for a quick discussion, machine learning, this study corroborates other research that states that machine learning has promise for measuring MS disease activity. However, this is not quite yet clinically ready, and although Chipness is using OROC of 0.8, which is quite generally useful, others say more data and experimentation is needed. As form states, thought that the methodology section was unclear in some parts, especially for protein selection steps and the adjustment factors used for the LSR normalization techniques. And additionally, at least once they mixed up the labeling of regression and classification results. And that's it.